Hello everybody and welcome back to Astranti Connect. Are you curious about dialectical behaviour therapy? Well, whether you're an aspiring counsellor, somebody already working in the mental health industry, or just somebody that's fascinated by all things psychology and mental health, DBT is a game changer. In this video, we're going to talk about what DBT is, why it's so effective, and why it's such an essential tool to have in your toolkit as a future counsellor or therapist. We're even going to end with an industry-specific DBT practice that will be such a fantastic hack to learn as a future counsellor. So stick with me for the next few minutes, because this could change the way that you think about therapy. But firstly, some background and basics. So what is dialectical behaviour therapy? Well, originally it was introduced and created in the 1970s and 80s by Dr. Marsha Linehan, and it was the first psychotherapy to formally introduce or incorporate mindfulness. Originally, it was created to assist people with borderline personality disorder. Over time, it's evolved into a really powerful approach, and nowadays it's used to help people with PTSD, substance abuse, and even eating disorders. In a nutshell, what makes DBT unique is its focus and emphasis on balance. So balancing accepting emotions with strategies for change, and it's this combination that makes it so effective. Primarily, at its core, DBT is a blend of cognitive behavioural techniques and mindfulness practices. The actual word dialectical means bringing together opposing ideas. So, for example, a client might feel deeply stuck over a situation, but they can still take small steps toward change. So DBT helps people manage these contradictions and polarizing thoughts and ideals. If we break DBT down into its four main components, these are the pillars of this therapy. So what are they? The first pillar is mindfulness. So this one is all about clients staying present in the moment. It's about acknowledging their thoughts and feelings without being too overwhelmed by them. A metaphor that's used quite a lot with mindfulness in this practice is think of it as hitting the pause button during an emotional storm and taking stock of how you feel physically, mentally, and emotionally. The second main component of this theory is distress tolerance. This is what helps clients get through extreme emotional turbulence without resorting to harmful behaviour. Another key component of distress tolerance is this idea of when you're in crisis, accepting your environment for what it is without demanding that it be different. So it's about sort of accepting the reality of the situation that you're in and using skills and techniques that you've previously learned to help you manage your emotions in that moment. For example, somebody might use the ice water challenge to quickly reset themselves and calm them down and bring them back into the moment during an anxiety or a panic attack. The third of the four main components is emotional regulation, which is all about helping clients to understand their emotions to therefore manage them better. This isn't to say that any negative emotions you feel are invalid or unimportant, and it's not about getting rid of them entirely. In fact, they are valid, important, and natural, but because they can make us feel bad, it's about learning to manage them. And a key part of this theory as well is remembering that emotion drives behaviour. So for example, if we had a client that struggles a lot with anger outbursts, DBT would help them to identify their triggers and then respond calmly. And the last of the four main components of this theory is interpersonal effectiveness, and this focuses on building healthier relationships. A good example of this would be somebody learning to set boundaries and say no and not feel guilty. So those are the four main components. So to bring it back to the main point I said at the beginning, when we say it's about balancing acceptance and change, picture this as a key example. Imagine a young person who is suffering from really severe anxiety and they've started to engage in dangerous maladaptive behaviours. DBT will help to validate their emotions and their struggles while also teaching them healthier coping skills to replace these health risk behaviours. And it's this duality of this approach that makes it so effective. But why should we as aspiring counsellors and therapists care and learn about DBT? Well, the way I see it, there are three main reasons. Number one is versatility. So although it was created originally to help people with borderline personality disorder, it's not limited to helping people with just one condition. In fact, its skills can be adapted to help clients with a range of challenges. Number two is practical skills. This is because DBT focuses on giving clients skills that they can use in practice right away, and that can make therapy feel really rewarding and quite actionable. It also means that when they leave therapy, they've got skills that they can use if they need it in emotional crises situations straight away. And lastly, it's because it's in demand. DBT trained counsellors are in demand in clinics, private practice, agencies, and hospitals. So it seems to be that being trained on DBT can actually open doors in your career. So those are the main three reasons. And I think to draw it all back to one point, it's that even if you don't specialise in DBT, its main components can enhance any therapeutic approach. And this is because the emphasis on mindfulness, the skills you learn, and balancing emotions are universal. And lastly, as I said we would, we'll end on one DBT example practice, and this is called the stop skill. This is a great tool for handling emotional crises. It's simple, but it's effective. So the S stands for stop. This is about not acting on impulse, and if you can, taking a pause. The T is take a step back, breathe, center yourself. And this is kind of drawing on those mindfulness techniques. The O is for observe. Notice your surroundings, notice your emotions and how you feel. Take stock of what you're feeling in your head, in your mind, and in your body. And then the P stands for proceed mindfully. Trying to continue on calmly and in control and asking yourself, what could make this situation better or worse? And what are my options here? And how can I continue? So this stop skill is meant to be most effective when emotions are running quite high and you feel overwhelmed and you want to calm down and regain a sense of clarity and control over how you feel and over your next forthcoming behaviours. And that is the stop skill. So whether you're early on in your counselling days or you're already deep into your journey, learning more about DBT can enhance your life and your future clients. If you want to learn about more therapy techniques similar to this, or maybe you're tempted to become a counsellor as a career, I'd highly encourage you to check the link in our description for the link to our website. This is where you can check out the CPCAB Level 2 courses that we run, which is the first course that you would need to become a qualified counsellor in the UK, to see if it's a good fit for you. Otherwise, you might want to check out the rest of our channel to see more of our therapy techniques explained videos, or take a look at our TikTok at Astranti Connect. And let us know in the comments if you think DBT is worth the hype it seems to be getting at the moment and what your thoughts are. If you enjoyed this video, please give us a like, subscribe, and let us know what therapy techniques you might want to learn about next. And we'll see you next time.